Hi, everybody. My name is Emily Turcott, and I am an admission counselor here at Regis. I've been here for a little over a year and a half, and I cover Metro West Boston as well as North Shore Mass, out through the Worcester area, and as well as New Hampshire. So I do cover a pretty significant part of Massachusetts. Um, I am recording right now from our Office of Undergraduate Admission here at Regis College on campus. I'm here on Wednesday, so it's really exciting to be on campus, see some familiar faces, socially distanced, of course. And today I'm going to go over our Young School of Nursing. So on campus, the nursing program is our largest program on campus. About 60% of our undergraduate students do fall into the School of Nursing. Some things that we really like to highlight within our nursing program are our actively practicing faculty. All of our faculty in the nursing program are still practicing nurses. So they're out in the fields right now, especially with the pandemic. It's never been more important for them to know exactly what's changing, because it does change day to day, what the proper protocols are, how to stay the safest, and all of the different innovations that are coming up in the healthcare system right now. We do also have clinical lab simulators, as well as the mannequins that you'll see that kind of act as patients in our nursing labs. They're set up just like hospital rooms. So we have those mannequins in there that do everything that a patient would be able to do. They're able to speak, they're able to have heart attacks or strokes or anything that you'll be seeing in a hospital setting. You'll be able to practice on those in those clinical labs. They're not a replacement for clinical, but they are there to kind of supplement your learning. And in terms of our NCLEX pass rate, we have about a 90% pass rate for our undergraduates the first time that they take that. That really does come down to one or two students who don't pass that first time. And then we do also have our nursing resource center on campus downstairs next to the labs. So that nursing resource center is really there for students to take advantage of. We have a lot of different computer programs, textbooks, nursing students studying, nursing faculty coming in and out. So you're able to study together or, talk through some things that you might be having trouble on with some nursing faculty, or use one of our computer simulations to kind of work through it as well. For our clinical rotations, we do use a lot of local hospitals. So we do use a lot of the Boston area hospitals, Brigham and Women's, Mass Gen. We use Newton Wellesley, Boston Children's. We use the main campus in Boston as well as the one in Waltham for our clinical rotations. We use Metro West Medical Center, Boston VA, so a lot of different options. We do try to get students in those big Boston area hospitals as well as some smaller community hospitals as well, so that they're able to kind of experience both that big hospital setting as well as that smaller hospital. To apply, it's pretty straightforward for first year students. We're looking for the common application. We don't have an application fee this year, which is really awesome, so you don't need to worry about paying to apply. On the common application, we'll need your essay as well as your high school transcript. And then we'll also need one letter of recommendation from either your guidance counselor or teachers. If you're going the route of teachers, I would definitely recommend getting a recommendation letter from either a math or a science teacher, just because those are the subjects that we really look for. And then we are completely test optional this year, so we're not requiring any SAT or ACT scores. In terms of admission requirements, we're really looking for a 3.0 recalculated GPA, and then a 2.7 GPA in your math and science specifically, and then 4 years of both math and science coursework. For financial aid, 100% of our students are receiving some sort of assistance. So that comes in the shape of a merit scholarship. So those are kind of determined based on your GPA. When you apply, we do recalculate. And then testing is not factored in, especially this year since we're not requiring test scores. And then to determine any need-based aid that we give from the school, we're using the FAFSA. And then we do have some additional scholarship opportunities through the school as well that you can apply for. So thank you so much for coming. I hope that you were able to learn a little bit more about our nursing program. Our contact information is up there. If you have any questions, feel free to reach out. Thank you.